Hello students, welcome to the field of medical sciences. So, as you have entered to the medical college, the first subject you will be encountering is anatomy. And it is one of the basic subjects where you will learn all about the structure of the human body. So, let me introduce myself to you. I am Dr. Deba and I have completed my MBBS and then completed my MD in anatomy from AIMS New Delhi. Currently, I am working as an assistant professor in Dreams University, Cuttack. So, students, before we learn about any field, we should have a brief idea about the history of that field. So, let's have a look at the different renowned names in this field who have been instrumental in shaping the knowledge that we possess today. So Hippocrates, he was a famous Greek physician and he lived between the century 460 to 377 before Christ. He is also popularly known as the father of medicine, and the humoral theory has been attributed to Hippocrates. According to this humoral theory, he had divided the fluid present inside the human body into these four types. These are the blood, phlegm, yellow bile, black bile. And he was also the first physician who attributed the cause of diseases to the natural causes. Then, around 325 BC, came another renowned person known as the Herophilus. He is known as the father of anatomy. And why he is famous? Because he performed the first vivisections, that is, dissection on living human beings, and also dissection of human cadavers. Now, students during that age, the prisoners, they were sentenced to death and sent to these universities where they were used for study of anatomy. So he was also the first person to regard the brain as the seat of intelligence and not heart, which was the popular belief till then. He also described about the various structures of the brain such as the cerebrum, cerebellum, the fourth ventricle. He also classified the nerves into two types, that are the sensory and motor nerves. Then another renowned person we should know about is the Vesalius. He carried out his studies between 1514 to 1654, and his work, which is very famous, is known as the De Humani Corporis Fabrica, and it was a book comprising of 7 volumes. So his work was followed for almost 2 centuries, and he is referred to as the father of modern anatomy. All right. So coming to the main topic, that is, what is anatomy? Students, it is usually defined as the study of the body parts and their relation to the other structures. Now, this word was derived from two words known as ana and tome. Students, tome, it means to cut apart. And what does ana mean? It means to see or to observe. So anatomy basically means to cut and observe. So we cut open the human cadaveric bodies and then we see inside to have a knowledge about the different structures that we see. Anatomy has a large number of subdivisions. We will be learning anatomy under various subdivisions such as the gross anatomy, the microscopic anatomy, the surface anatomy, the embryology, and also we'll learn about the applied anatomy. So students, don't be afraid of seeing so many subdivisions. Let us have a brief look at each one of them. So before that, I want to tell you certain features. Like when you'll open your book, you will find a large number of diagrams in your anatomy book. Now diagrams are an essential part so that you have an idea of the structure of the organ. So all these diagrams across all the books, you will find they have a certain color code. So if you look at any structure and if it is an artery, then it is colored in red. If it is a vein, it will be colored in blue. If it is a nerve, it will be colored in yellow. And bones and skin, they are just given a black outline. All right. Then muscles, they will be in brown color. Lymph nodes, they will be colored in purple. The joint capsule, ligaments and tendons, they are generally colored green. The synovial membrane, it will be colored pink. And finally, you have the organs. The organs, they will be colored in orange. So when you open your book, just have a look at the different structures and what is the color given. So from that you can identify whether it is a vein, artery, nerve or any other structure. So students, here is something you have already learnt from your school days till your 12th classes. The levels of structural organization. We know that the smallest unit of a living organism is the cellular level. So these cells, they are formed from different biomolecules. So these biomolecules, they together form the cells. These cells together will give rise to tissues. The group of tissues together functioning as an organ. And finally, a system of organs leads to an organ system, and large number of organ systems together form the organism. So this is the structural organization right from the cellular level to the organism. As I had told you, there are different subdivisions of anatomy, and the first I had mentioned was the gross anatomy. Now student, what do you mean by gross anatomy? So in gross anatomy, we will be studying anatomy by cutting open the cadavers. We will dissect its part and we will see for the different structures. So that is gross anatomy. Here you can see it is a section of the head and the neck region. So we have cut open to visualize the different structures and learn. Then comes the microscopic anatomy. So microscopic anatomy, also known as the histology. In microscopic anatomy, we will see the ultrastructure of different organs. And here in this image, you can see this is nothing but a large artery placed under microscope. You can see large number of elastic fibers present in this. This large number of wavy fibers known as the elastic fibers. So you can clearly see the ultrastructure. So you can see the ultrastructure of the artery. Similarly, any organ put under different processing methods, then slides are prepared and finally viewed under the microscope to learn its histology or the microscopic anatomy. Next comes the developmental anatomy or embryology. So students, in embryology, we will be learning about the development of an organism right from the formation of the gametes to the process of fertilization and finally the embryogenesis till it develops into a complete life fetus. All right, so here in this image you can see a developing human embryo. This is the developing kidneys. We will learn about them in detail when we have their specific classes. In this image you can see the three layers which give rise to the entire human. All right, so all these things will be discussed in embryology. Coming to another subdivision, that is the radiological anatomy. In this, we use various radiological modalities. The various radiological modalities such as the X-rays, CT scans, MRI, ultrasound or ultrasonography. All these methods are used to visualize the internal structure of the human beings. So here you can see in this image, you can see the bones forming a joint. So as you learn more about anatomy, you can identify which joint is this. For your information, this is the elbow joint. Similarly, here you can see the X-ray showing a shoulder joint, and subsequently you will be learning how to identify any pathology. So I can say here there is a dislocation of the elbow joint. All right. So coming to the next subdivision, the clinical or applied anatomy. Students, whatever you learn about the normal human anatomy, all those things will be finally applied in your clinics. When you meet the patients, there the application of anatomy is done. So here you can see an image of the normal circle of Willis, which is taking the brain blood supply to the brain. Now here you can see a defect being formed in this circle of Willis, which is known as the Berry aneurysm. The proper knowledge of the anatomy of the circle of Willis is required when a person having a brain hemorrhage comes to you. Now let's have a discussion about the nomenclature. Like in your 12th class, you have seen that there is some nomenclature for chemistry, for hydrocarbons, the IUPAC nomenclature. Similarly, we have the nomenclature for different anatomical structures. So why it was done? It was done to maintain a uniformity all around the world, so that all the textbooks they have the same terms and there is no confusion. So in 1895, it was the German Anatomical Society which approved a list of 5,000 terms, and what was it known as? It was known as the Basel Nomina Anatomica. So this Basel Nomina Anatomica, it was followed very recently, and it has been now replaced. It has been replaced by the Terminologia Anatomica. So some basic rules were laid down by this society for naming the different structures. Some of these are that each part it should have only one name. The names will be in Latin. They should be short and as simple as possible. They should be easy to memorize, and related terms they should be identical or similar. Okay, students. Now moving on to the next topic, which is very important, that is the anatomical position. As first year students, the first thing you should learn is what is the anatomical position and why it is important. Now, students, as you can see in this image, the person is standing straight with his gaze forwards, with his arms by the side of the body, palms facing forwards, legs straight, and the feet parallel. So these few features which you can see, that is the gaze forwards, arms by the side with the palms facing forwards, legs straight and together, and feet parallel to each other. So this position is known as the anatomical position. And students, why it is important? Because all the anatomical terms, the relations, these will be described on the basis of this anatomical position. All right. So some important terms. These terms will be frequently used, and mastery over this will help you read the books properly and also follow the lectures. So first, let us say here a person is standing. You can see very well in this image, this person is standing. So anything towards the head, that will be superior. Anything towards the leg, that will be inferior. All right. Now anything present in front, that is anterior. Anything behind, that will be known as the posterior. Now students, for anterior and posterior we also have two synonyms. The anterior is also known as the ventral and the posterior is also known as the dorsal. All right. So if you look at this image, this part of the body is ventral, whereas the part of the body behind it is the dorsal. Coming to some other terms. Here you can see section of the arm has been done, and in this section it has been enlarged in this image. So what you can see in this enlarged section taken from the arm. So you can see there are some structures present in the center, some structures present at the periphery, and some structures which are present in between. So the structures which are present in the center, these are known as the deep structures. Structure at the periphery or towards the outside, these are known as the superficial structures. And in between, whatever is lying, that is in this case the large number of muscles, these are the intermediate structures. In case of our palms and our foot, some difference is there, like we name this part of our hand as the palm and this portion is the dorsum. So when you are standing in the anatomical position, it is the palmar surface which is facing anteriorly or facing ahead, whereas this is the dorsum of your hand which is facing posteriorly or ventrally, dorsally. Similarly, here you can see in case of the foot, you have this is the dorsum of the foot, whereas here this is the sole of the foot. Now the palm and the sole, they are quite distinct, they have quite distinct skin from other parts of your body, because these parts they are regularly facing some abrasion, like when you are walking, when holding something, so they have a thick skin. All right, now coming to few other important terms. Now students, in case of limbs, if I take a point near the shoulder and if I take a point near the wrist, so I'll say that this point is proximal, whereas this point is distal. So what is this concept of proximal and distal? So students, this is the axis of our body. So as you can see, this is the axis of our body. So anything nearer to the axis, that will be proximal, and anything away from the axis, that will be distal. So I can say that my elbow joint is proximal, whereas wrist joint is distal. And if I compare these two, then wrist joint is proximal and the tip of my finger is distal. All right. So students, these few terms will be repeated over and over again throughout your textbooks. So kindly be clear with these things. Then moving to the next important topic, the different body positions. We have to know about the supine and the prone positions. Supine and prone position. So what is supine position? When a person is lying down flat. So when is lying down flat on a surface with his face upwards, the thorax, abdomen upwards, as well as the other parts all facing upwards. Or we can say when a person is lying down with his anterior or ventral aspect facing upwards. So that position is known as the supine position. Whereas when a person is lying down just opposite to the supine position, that is his posterior or the dorsal aspect is facing upwards. So that is known as the prone position. All right, so students, you should be clear about the supine and the prone position. So this position is known as the lithotomy position. This position is very important because in this position a large number of surgeries are carried out of the anal region, of the rectal region. Also the childbirth is done in this position. Students, remember this position, that is the lithotomy. Alright, so you can see the person is lying down flat on the surface with his legs raised and supported by these two structures. Legs are raised, supported and placed wide apart. So this is a good position for childbirth and also anal and rectal surgeries. Coming to few other important position, that is the Fowler's position. So here you can see the person's head has been elevated by 90 degrees. Alright, so actually it is between 45 to 90 degrees the person's head is elevated, and this is very important in case of old age patients to help them breathe, and also it helps to get access in case of surgeries of involving the shoulder joint or any upper limb surgeries. Then we have the Trendelenburg position. In this position you can see the head is at a lower level than the legs. So the person is lying down on a flat surface with his head at a level lower than his feet. So this type of surgery, this type of position is very important in case of the surgery of the lower abdominal organs. So in this position, the abdomen organs, they separate or move away from the pelvic organs, helping in the proper surgery of the lower abdominal organs. Then just opposite to that, we have the reverse Trendelenburg position. In this you can see the head is at a higher level than the feet. So this is a position which is helpful in case of the upper abdominal organs. In this position they separate away from the thoracic structures and move down. Then coming to the next position, which is known as the Sims position. In this position you can see the patient is lying down in the left side. So the patient is lying down on his left side, and what they have done, that the left leg it is kept straight, whereas the right knee, this is the right knee has been bent. The right knee and the hip joint, it has been kept bent, whereas the left leg is straight. Now this position is also known as the lateral recumbent position. Alright, so this is also known as the lateral recumbent position. This position is helpful in case of rectal examinations, also in case of inspection of the perineal region. So students, these are few important positions which you should have knowledge about. Now coming to the next part, which is the body planes. Now students, what do you mean by body planes? Now to make it easier, have a look at this image. Here is a person who is standing in the anatomical position, and you can see there is a plane which is passing from anterior to posterior. So this is the anterior, this is the posterior. From anterior to posterior a plane is passing, and this is dividing the human body into the right and left halves. So equal right and left halves. So this plane is known as the median plane. So remember guys, the plane passing through the human body from anterior to posterior, dividing it into the right and left halves, is known as the median plane. And here is another plane. This smaller plane, it is passing again from anterior to posterior, but it is not passing through the complete center. It is passing somewhat lateral or away from the center, and it is also dividing the body into a larger right and smaller left half. So such a plane is known as a sagittal plane. So median plane, the plane passing right through the midline, dividing the human body into equal right and left half, and the sagittal plane which is passing parallel to the median plane. Alright, here you can see the median plane of the foot. It is also passing from anterior to posterior, dividing into right and left halves. Then coming to the next planes. So this plane you can see it is passing from the right side to the left side. So from the right side to left side it is passing, and it is dividing the human body into two halves, the anterior half and the posterior half. So this type of plane which divides the human body into the anterior and posterior halves is known as the coronal plane. What it is known as, student? The coronal plane. Then the third plane. This plane divides the human body into a superior, the upper or superior half, and the lower or the inferior half. It is passing through the body. It is at right angles to the coronal plane, and it is known as the transverse plane. Alright. So you learnt about the three planes, that is the median plane. It has also a parallel plane that is known as the sagittal plane. Then you have the coronal plane, and finally the transverse plane. So students, to visualize the different structures, we take the different sections and planes. Also, it is of high importance in case of radiology, because the CT scans, the MRIs, you will find them taking images of different sections of the body. It can be of a transverse section of the body, it can be of a sagittal section or of a coronal section. So having knowledge of the different human structures present in different planes, which structure we will encounter if we look at the sagittal plane, which structures we will encounter if we move along the transverse plane. So knowledge of that is also of utmost importance. Here are some images to show how the different planes they divide the body. So you can see this plane which is dividing the leg of the or the lower limb of the person into the right and left halves. It is passing through the midline. So what do you call it? It is the median plane. So it has been sectioned along the median plane. So this is how it will look if you look from one side. Now here you can see a plane has passed through the arm, and it has divided this arm into a section like this. So which type of plane it will be? It will be the transverse plane. Why transverse plane? Because it divided the human body into the upper and the lower halves. Now coming to this one, what type of plane this will be, students? Now you can see it is not equally dividing it. It has passed somewhat tangentially. So this is known as a oblique section. All right. So this is a oblique section. So these are the different types of sections you will get if you divide along different planes. Along the median plane you get this longitudinal section, along the transverse plane you get this transverse section, and along an oblique plane you get the oblique section. Then coming to some of the movements. Now students, you can see these are some of the movements that the human body does. You have been doing it throughout your whole life till now, but now you will be learning about those movements. What are they called? All right. So here you can see in this image, this person, she is taking her hand back, and then again it is being swung to the front. So from back to front. So as I take my hand back, it is known as extension. Whereas when I move this hand forward, it is known as flexion. Whereas in case of leg, what you can see, the same in case of this hip joint. Here we are talking about the shoulder joint. At the hip joint, here you can see when we take the leg behind, it is the extension. When we take this leg forward, this is the flexion. All right. So students, generally extension is a movement where two surfaces, the angle between two surfaces are, the angle increases, that is the extension. But when I am doing this, you can see the angle between the two surfaces, it is reducing. So this decrease in angle, when I'm moving this, it is known as flexion. And when I'm moving these two surfaces away, this is extension. So that is how you can remember. See, in this image you can see at the elbow joint. At the elbow joint, these two surfaces, they are moving towards each other. So this is the flexion. At the knee joint, these two surfaces are moving towards each other. So this is the flexion. And the opposite is extension. The same flexion and extension at the neck. So when you are moving your head back, this is the extension of your neck, whereas when you are moving it forwards or bending down, it is the flexion. So here are the images of the movements of the hand, because the hand, the foot, they have some special movement. They are not like your other parts of the body. So you can see here, this is the extension, this is the flexion at the wrist joint, and at the carpophalangeal joints, metacarpophalangeal joints, you have the flexion, extension. Now, one of the characteristic features of human beings, not many animals have this characteristic feature, that is the opposition of thumb. As you can see, you can take the thumb and you can touch tip of any finger. So this movement is known as opposition. And when again you take back your hand, open it, this is the reposition. So opposition, reposition. This movement is one of the key factors in the evolution of human beings. All right. Not many animals use our upper limbs as human beings do. Then coming to the thing I told you already, the supination and pronation. So when the palmar surface facing down, this is the pronation. When it is facing upward, this is supination. All right. Supination, pronation. So when you are taking something, when someone is giving you something and you are taking, this is the supine position. And when you are giving something, like you are dropping a key into your friend's hand, that is a prone position. All right. Now students, two other important terms, the abduction and adduction. You need to visualize that. First, let me show you in case of hand. So in case of hand, you can see this is the median plane. In the medial, this is the median plane. It is passing through the middle finger. So as we move the fingers away from the middle finger, this is the abduction. All right. And when we move it towards the middle finger, that is the adduction. So when you are moving towards the middle finger, you are adding all them. So just remember, this is adduction. But when you are taking something away from the midline, so you are abducting. Hence, it is known as the abduction. So here, in case of the upper limb, what I told you, as you take any structure away from the midline, it is getting abducted. So abduction. To kidnap. To kidnap means to abduct. So abduction. To kidnap means abducting someone. So when the movement takes away from the midline, it is the abduction. But when I'm again bringing it back towards the midline, it is adduction. When I'm rotating my hand outwards, it is lateral rotation. When I'm moving it inwards, it is medial rotation. So for that, you need to know what is lateral, what is medial. All right. So students, anything closer to the midline. If I say this is the midline passing through my nose, so here I have my eyes, here I have my ear. So my eyes are closer to the midline. So I will say my eyes are medial than my ear. My ears are away from the midline than my eyes. So my ears will be lateral than my eyes. Alright. So here is the midline. Here you have my eyes and here is my ear. So this structure is a medial structure. This structure is a lateral structure. So medial lateral. So when your upper limb, you are rotating it towards the midline. This is medial rotation. You are rotating it away from the midline. This is the lateral rotation. The same thing follows for your lower limbs. Circumduction. This is also another important movement. Now you can see this is the lower limb. This is the resting position. Then what he is doing, he is taking and turning, moving the foot in a circular motion. So what is happening? The upper end of the limb is fixed at this position. However, the lower end is free and it is rotating. So you can see it is forming a cone. The lower free end forming the base of a cone, whereas the upper fixed end is the tip of the cone. All right. So this type of movement is known as the circumduction. All right. So this type of movement is known as circumduction. Also, it can be seen in case of a shoulder joint, where I am rotating it like this. You can see my hand, it is forming the base of the cone, whereas my shoulder joint, it is at the apex of the cone. All right. So in case of foot, you have the dorsiflexion and plantar flexion. So what is dorsiflexion? Now look at this image. So here this is the dorsum of the foot and here is the plantar surface. The dorsum which faces upwards and the plantar surface which is in contact with the ground. So when you move your feet like this above, this is known as the dorsiflexion. But when you move it below, your plantar surface is getting flexed, it is the plantar flexion. All right. So these are few terms which are different in case of the lower limb. Also, the movement of the feet inwards. Inwards means towards the midline. So here is the midline. Towards the midline, you have the inversion inside. Whereas away from the midline, it is the eversion. So inversion, eversion of foot. All right, here you can see the person bending her upper trunk or the torso. This is known as the lateral bending. So as you are moving your head from side to side, that is the rotation of neck. Students, remember all these type of movements, they are possible due to several joints, special types of joints present. So in coming classes, we will be learning about those joints also. So for now, you have a idea about the different movements. Here you can see the rotation of the neck. Also here you can see the rotation of the upper trunk. The shrugging of your shoulders. This is the elevation. This is the depression. All right. When you do this, this is the elevation. This is depression. And another special movement present in your face, the mandible bone, this jaw bone. You can move it forwards. When it is moving forwards, it is known as protrusion. When it is moving backwards, it is known as retraction. All right, so protruding and retracting. Protrusion, retraction. So here in this image, you can see another movement, that is the movement of the bone of your back. What is that bone known as? It is the scapula. The scapula is also known as the shoulder blade. So when you are pushing against something, pushing against a wall or doing push-ups, so there happens the movement known as the protraction. All right. The scapula, the shoulder blade, it moves anteriorly, laterally. Whereas when again you are taking back your arms, this scapula again retracts back. or moves back it to its anatomical position, or medially, posteromedially. So when it moves anterolaterally, it is the protrusion. When it moves posteromedially, it is the retraction. So students, that is all for today. Tomorrow we'll carry on with the next part of this lecture. Thank you.